Welcome to AETCM, the Emergency Medicine Channel. Today we are going to discuss a case of a dog bite. Today we received a patient with a case of dog bite to the ear. Okay. As it's an individual injury, we continued with the examination of the bite instead of the primary survey and the second.
Where was the bite?
Dog bite was to the right hand.
Okay.
So when the patient was petting the dog has bitten the hand. So both the proximal palmar and the dorsal side, both said there is a laceration bite wound present.
Okay.
So on initial examination of the wound, there is a laceration of
You tell the primary survey.
The primary survey, patient is able to talk in one full sentence. So there is patent and the cervical spine, there is movement, active and passive movement, no spine, C-spine tenderness. Next, coming to breathing, patient was having 20 respiratory of 20 per minute and saturation 99% at room air. Bilateral air entry was chest raise was equally present. No use of accessory muscles. Next, coming to the circulation, patient's heart rate was 90 per minute and BP was 120 by 80 mmHg. At this point, one IV cannula was placed and blood samples were taken. And coming to the next disability, patient was having GCS of E4, V5, M6. Pupils are bilaterally reactive. And coming to the exposure part, patient was having a lacerated wound on his right hand, both palmar and dorsal aspect. Palmar aspect, he was having a bite, punctured type of a wound, and dorsal aspect, he was having a lacerated wound of 2 into 1 centimeters. Okay. At present, there is an active ongoing bleed in the dorsal aspect. Coming to the history wise,
adjuncts, what can you do at present? What can you do after the primary survey?
After the primary survey, adjuncts we would be requiring to see what's the hemoglobin.
Anyway, you have inserted an IV cannula, you can take the blood samples and check that. Then medications, what will you be giving?
Right now we would be assessing the pain.
Now there is active bleeding, so problem is only in the C. In the primary survey, otherwise everything is okay. So only problem is in the C. So for active bleeding, what will you do?
We'll have the compressive bandaging done at this point initially to stop the active bleeding.
Since it is in the hand, it might be able to do a bandaging. You can give direct compression.
Compression.
Tourniquet also will be difficult mostly, so you will have to apply it on the wrist or somewhere. So direct compression you can give. Then anyway, since you have inserted an IV cannula, you can give Tranexa injection also. Okay.
And at this point, like the events,
then you can manage pain also.
Pain management. He's having a score of 7 by 10 pain management. So injection PCM 1 gram was given.
Okay.
Apart from that, as the events leading were a dog bite, and patient had already cleaned the wound with the fresh flowing water and has come. So as he's having pain at the local area of touch, and a subcutaneous anesthesia was given to numb and thoroughly washed. First cleaning.
How will you give anesthesia? Patient has bitten in the hand. No, where will you give anesthesia?
Subcutaneous anesthesia.
You can give a wrist block if you want, but otherwise you can't give local anesthesia in the hands. No. Okay. If you are giving wrist block, it is fine, but otherwise you can't give any local anesthetic in the hand because that itself can cause hand space infection will be there. So you can't give. If you want, you can give local anesthetic. You can tell that spray you can give, but that also might not be effective. You can give IV or blocks. Okay. If it is bitten on the tip of the nails, where will you give?
Ring block is the
ring block you will have to give. Okay. So even though patient tells you that he have cleaned thoroughly, we will have to again clean the wound and remove all the debris.
And the saliva of the dog was to clean properly.
Okay.
Initial management would be the cleaning of the wound. Next, second would be the stopping the bleeding and the wound care management. If the patients there is a deep cut or anything, we will prefer it to go with secondary healing rather than suturing it up, as it's a dog bite.
So what all bites are considered as tetanus prone other than dog?
Any warm blooded animal, mammals are all considered to be
especially
rabies. Dogs, canines and the
dog bite, cat bite, then fox bite, then what all? Porcupine bite, bat. These things are considered a somewhat higher risk category for causing rabies. Low risk category?
Low risk rodents.
Rodents, especially rat, mouse, and all, even though they are having higher tendency to cause other problems like infections, lepto, these things and all, these are considered less chance for rabies. So, rat bite, rabbit bite, these bites are somewhat considered low risk for rabies. Okay.
After the initial wound care management, then as this is a case of canine
wound care management, what all did you do? Direct compression can be done, and cleaning was
cleaning
done.
with the like povidone, iodine or betadine to clean to like 3 types of we can do mechanically by cleaning with the water, next chemically by using the disinfectants, next biologically by giving the HRIG, human immunoglobulin, directly at the site to neutralize the vaccine. These are the 3 ways we can neutralize vaccine at the site of the bite.
Okay. So what all disinfectant do we have here?
Usually we have the
we have betadine, then
betadine and sterilium.
Sterilium is there also. When will betadine act? When will sterilium? What is the difference between those two?
Mucosal.
It is anyway used to clean a surface. So whenever you are applying betadine, especially you might be seen betadine in the OTs and all. So when will they start the surgery? Once they will apply betadine, once it starts drying, then the antibiotic, then its action starts. Then only they will be keeping an incision, these things and all. But if you are using sterilium and all, this antibiotic effect or the disinfectant effect will only be there when it is wet. If once it starts drying, that effect will go. Okay.
And as is a dog bite, you have to consider giving him a rabies vaccine and first categorizing the wound.
And wound, categorize the wound, yeah.
Categorizing. So category 1 would be just a lick on the surface and there is no any epidermal tear or break.
Intact epidermis.
Second would be an abrasion without bleeding. Category 3 would be skin epithelium, break in the skin epithelium with bleeding or mucosal surface contact.
Okay. So, will you suture this wound?
To decide whether to suture or not, like only the this lacerations on the face should be considered to be sutured in a dog bite. On the hands or any punctured wounds, everything should be avoided. Suturing should be avoided.
Ideally, suturing should be avoided, whatever bite it is. Face we can consider only because of the cosmetic issues. Otherwise, avoid. Which all are the other contraindications regarding the bite? Contraindications for suturing?
Punctured wound, crushed, completely crushed wound. And if the time of duration is more than 12 hours for the bite, then we don't suture it.
Okay, so we can consider suturing only if the patient comes in a delayed process. If the patient comes after 2 to 3 days without any infection and all, then we can consider suturing. Otherwise, avoid suturing. Okay. If at all suturing, how will you suture?
We just subcuticular level only we need.
No, subcuticular are not supposed to suture. You can give normal simple sutures you can apply. Subcuticular, what happens is it will be a very tight suture. No? So whatever infection or if any collection is there, it will not have space to escape. So put simple sutures only. Okay.
Next, depending on this.
And cat bite.
Cat bite usually will be a punctured wound, so there we should never suture. More chance of infection is there in cat bite than the dog bite.
This patient came with a bite on the hand, right? So is it a serious?
Category 3 because there is bleeding.
So category 3, depending on the site, how can you tell whether it is severe or not? Which all are the sites?
If you provoked or unprovoked.
Direct injury to the nerve, the closed nerves are
that will be severe. And other than that, which all bites will have more tendency to cause rabies or infection? Which all sites, bite sites? Hand. Then foot.
face,
groin, genitalia, then
Head.
Head. In small children, head, there can be a depressed skull fracture, these things and all. Then joints. if there is a bite in the joints, or if there is a patient who is having any impaired lymphatic supply or impaired blood supply, or like PVOD patients, or impaired venous
Stasis of
drainage, stasis blood vessel, that, and any prosthetic limbs or prosthetic joints, these areas and all, chances of infection is high, and depending on the contamination, if it is very much contaminated, if it is deeply punctured, and if there is any crush injury and all, these also will have a high tendency for infection. Okay.
So in this patient, depending on this categorization of wound, it's category 3. And in category 3 wound, we have to go with active vaccination and even passive vaccination. Active vaccination by giving the vaccine. It can be an intradermal or intramuscular. Intradermally, the schedule would be 0, 3, 7 and 28. Whereas
How much ml?
That is, in intradermal we take 0.1 ml, 2 syringes and 2 sites we have to give.
Okay.
Whereas in intramuscular, we give it as 0, 3, 7, 14 and 28. There we give only one site, 0.5 ml.
Okay.
We prefer giving in IM in deltoid muscle.
Okay.
And the schedule would be given as per the dates. As this patient is category 3, even we should be considering passive immunization. Here we can consider to give human immunoglobulin or equine immunoglobulin. Human immunoglobulin dosage is 20 international units per kg body weight, whereas equine immunoglobulin would be given 40 international units per body weight. And the other newer variation would be given.
So if it is human, you told 20 international units per kg. So in an ampule, how much?
400 international.
In an ampule, usually it will 300 international unit will be there. So if patient requires 20 international units per kg, means patient will require at least 4 or 5 that HRIG might be required, which is very costly.
Yes.
Okay. Now you have?
We have monoclonal antibodies, human monoclonal antibodies. This dosing will be 3.33 international units per kg body weight.
How much will an ampule contain?
One ampule, depending, like it can be 250.
One ampule,
one ml.
2.5 ml, which will contain 100 international units. So patient might require 2 or 3 might be required. Okay. Where will you give this immunoglobulin?
More than 50% should be injected at the site of the wound, and mostly maximum should be injected at the site of the wound.
If at all possible and if at all anatomically feasible, try to give everything locally. Okay. If that is not possible,
the remaining can be given as an IM for far away site.
So when you are giving IM injection, give it away from the site where you have given the vaccine, because they will cross react.
Yes,
so there will not be effect. So give it away from the site of vaccine. Okay.
Apart from the next management, we should be considering is tetanus vaccine. And apart from tetanus vaccine, again, another part we should consider is giving antibiotics. Depending upon the patient's immunocompromised state, even maybe he is diabetic, or depending upon the site of the injury and the way of the manner of the injury, if it is crushed, mangled, there will be...
Which all are the microorganisms susceptible?
Usually, when there is an infection, it can be the human epidermal, like staph or strep, or it can be depending upon the species. In cats, usually it's pasteurella will be the microorganism. In dogs, it is a capnocytophage is the usual microorganism. In humans, it is Echinella.
Okay.
These are the specific microorganisms. In a generalized, antibiotic coverage can be given if we are suspecting an infection which can be present. The drug of choice can be the amoxicillin plus clavulanic acid. BD dose can be given. When we give a prophylactical antibiotic coverage, 3 to 5 days is the duration we give amoxicillin plus clavulanic acid BD dose. But if there is an infection which has been found out, then it will be 8 to 15 days we have to give the coverage.
Okay. So when will you decide whether the patient requires antibiotic or not?
If there is any cellulitis, abscess, or
prophylactically.
Prophylactically, if a patient is an immunocompromised patient is having like a lot of foreign material, or if there's a
Contaminated wound.
denture, like if the tooth of the dog is stuck in between the hand.
If there is, that means if there is any foreign body, then if at all you are suturing, we are not supposed to say, if at all you are suturing, you will have to give antibiotics. Then depending on the site, if the patient is having a wound over the site, whether there is no much blood supply or near the joints, we will have to. Then as you told, then another question. Suppose we are planning to give IV antibiotics. When will you plan on giving IV antibiotics?
When
That is only because only when patient started developing complications. Like secondary to the bite, if the patient is developing some abscess, not at all abscess, that also can be managed with oral antibiotics. If the patient is developing sepsis, in that condition we will have to give. Then if there is any deep space infections, then we'll have to plan on giving. And even after starting oral antibiotics, if the patient, after 48 hours, if the patient is still having symptoms, we'll have to plan on giving IV antibiotics. Okay.
And other would be the pain management, which we are
So
giving.
we will have to give gram-positive coverage and anaerobic coverage also. This patient you have started augmented. In another conditions like cat bite, rat bite and all, we will have to consider giving doxycycline. Okay.
Next would be the pain management. We're giving any paracetamol would be enough for NSAIDs.
Okay, okay.
And then when the discharge medications, we should cover again the remaining doses such as of the active vaccine, and the other thing would be pain management and antibiotics.
Okay. Which all are the complications which you will expect in this case? Complications.
As the infection, sepsis, one of the complication, or the patient developing
Where all the patient can get infected?
as in this case, it's the hand. We can have the spaces of the hand infection, cellulitis.
Then tenosynovitis can be there,
Tenosynovitis.
and even it can involve the small joints of the hands also. Okay, so we need to suspect that also. Especially you told cat bite, the wound will be more deep. So cat bite injuries and all, there is higher risk for synovial infection and osteomyelitis. Okay. Anything else?
Nothing.
Okay, thank you.